Cassie Herman from Riverside Health, a trauma, excuse me, my handwriting has escaped me here, a trauma program manager from Riverside Health. Cassie, it's wonderful to have you here. Nice to meet you, sort of live on air in the moment. I'm Connor. Thanks so much for joining us today.
Thanks for having me. I appreciate it.
Yeah, absolutely. The impetus of sort of how this connection was made is because the American Red Cross has officially declared the second national blood supply crisis in its history. When you hear a sentence like that, it sounds daunting, scary, and really heavy. Can you give us a little bit more insight into how dire of a situation this is?
Yeah, absolutely. So many people don't know that bleeding is the number one cause of death in trauma-related incidents. So having blood as that critical resource in our trauma base is crucial for us. Blood is not manufactured, so we can't just, it doesn't come from a facility. We can't make more of it. Um, and having that, um, having that there is very important to us. So we see the majority of the patients in the trauma in the city, and the vast majority of the trauma patients. So that shortage really can have a huge potential and impact on us. We see roughly 4,000 trauma patients a year. About 300 of those are our highest activation, our gunshot wounds, major car accidents, stabbings. So having a shortage of that resources can really be detrimental to us.
And when I think of the job that you guys have to do at Riverside every single day, and then we hear that there is just another external factor that is creating a difficulty, a stressor, I'm wondering when it comes to everyone at Riverside who's working so hard to do one of the most difficult jobs there is, how hard is it for you guys mentally to then also reckon with the fact that there is a shortage of this absolutely critical supply?
It's kind of crazy. Trauma nursing is a special breed. We are very resilient. We bounce back. And we're used to having ebbs and flows in our blood supply over the years. It just kind of does that. So it's nothing for us to, even if we're not short, to just, kind of have to be cautious about what we're using. So, we just train our newer staff and let them know, this sometimes happens, and we get by with what we can, and knock on wood, usually we get pretty lucky. And even if we kind of dwindle our supply down, we're fortunate that we can get it back up, the following day. Or um, I've been here for 20 years, and fortunately I've never gotten to a point where we have no blood. So we always have something there, which is helpful. But I don't want to think of the day that it might get to that.
Well, I will tell you this, your disposition does bring me a lot of comfort. Like you said, it sounds like you guys are very much ready for anything and are very sort of accepting of the circumstances and making it work. When you talk, speaking of making it work, I suppose you talk about at times maybe being cautious with what you're using. Can you walk me through strategies that you guys have when you are in a situation where supplies are low to
But we have
maintain?
diff we have different types of blood products. You've got whole blood, which kind of encompass. I don't want to get too high level, but whole blood kind of encompasses all of your blood products. And then you've got, red blood cells. You've got platelets and plasma, and we have all of those different blood products. And ideally, we want to give whole blood because that has everything in it. We don't have to give all of those separate pieces. And we have testing here that can show us what the patient specifically needs. So we're not just, giving them blood blindly. So we really, especially when we're short, we really utilize that testing to let us know that this patient doesn't need red blood cells, they need plasma or they need platelets. So we really use that to our advantage to make sure we're giving the patient exactly what they need.
Okay, and now when we talk about what exactly the patient needs, that universal donor is sort of the primary supply that everybody is looking for, that everybody is trying to make sure is filled and ready to go. That's type O. Now, I know you said you don't want to get too high level. Can you tell me
Yeah.
why type O is the most important?
So type O is, they call it the universal. It's the most commonly transfused. Um, it can be used in emergencies before we know the patient's blood type. So, if the patient's not critical and they just need a blood transfusion, we can send their blood down to find out exactly what type they are. Um, and type O, we are able to give before we know that blood product. So specifically O negative is imperative. We want to make sure we have that on hand because if a patient comes through the door and needs blood right there on arrival, we have that and we can give them that no matter what their blood product is, or no matter what their blood type is.
Okay, interesting. So type O negative is sort of that all fail. You can use this for anybody in any emergency situation. That's interesting to know. I did not quite realize the extent of how useful that was. I'm wondering. I know the American Red Cross is on this, and you have a million other things that you have to worry about day to day. But I just curious if you have any ideas about maybe how to fix this problem, possible solutions to get supplies back where they need to be and have them consistently be there.
Donate, donate, donate. It's such an easy thing to do. I'm not sure why people are nervous about doing it. Your blood regenerates, you start to reproduce it immediately, and within 24 to 48 hours, that blood is back in your system. You've reproduced it, so it's not like you're losing it for good. But yes, donate, absolutely donate. The American Red Cross has an app that's really cool. They do a lot of like giveaways. They'll give out t-shirts, they give out gift cards and things if you donate. And two, you can watch where your blood travels. So you can see what hospital it ends up at, and you can see, when it's used. Obviously not giving away patient information, but you can see when it's used and where it's used at.
Excellent. Can you one more time? Can you emphasize the app? It sounds like maybe that would be the thing that is most easy for people to kind of get their arms around and go and get things done here.
Yeah, it's the American Red Cross app, and you can see locations of blood drives. You can sign up for blood drives. And if you don't know your blood type, once you donate for the first time, you'll find out what your blood type is, and that's within the app, so you can see that at all times.
And a big congratulations if you end up getting that O negative, right? I mean, that's the top one. Since we have you here, is there anything else that you want to add? Is there anything else about what you guys are doing, the challenges that you're up against, that you want to include here before we let you go, Cassie?
I don't think so. I mean, I'm lucky to work for a facility that, is pretty well prepared for things like this. So luckily, knock on wood, we haven't really seen the effects of this yet, but that doesn't mean that it's not going to, come quickly with this shortage. But yeah, I mean, if I had one last thing to say, it's just donate, donate, donate.
Excellent. Cassie Herman from Riverside Health. We really appreciate you spending some time with us. The trauma program manager over at Riverside. Thank you for joining us on Live Impact News. We'll continue to push that message. Donate, 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 because those donations could save lives. And we really appreciate you coming on to help us express that.